Hi friends, this is just leisure time, coffee time. So, Dr. Alpa, want to ask, what is better, GCSF or PRP? Or we can use combine with each other, or we just give an SC before GCSF before PRP? Let's see what happened. Ask Alpa.
Sir, I have a doubt that the GCSF factor ideally to be given first before we apply the PRP therapy to the index cycle where we are assuming the thin endometrium.
See, when we are talking about the index cycle, in the index cycle, what is important is proper growth of endometrium. And for the proper growth of endometrium, we need growth factors which are very specific to endometrium. GCSF basically is a growth factor which is stimulating granulocytes only in the hematopoietic cells. Now, it will have some other effect because this is not a very specific one. It will have some effects on endometrium. But the effects are not so potent that it can be very, very useful for endometrial.
So not the specific thing.
It's not very specific.
Okay.
But at the same time, these platelet growth factors which are present in the PRP lysate, they have a full spectrum of growth factors. Now this full spectrum will work on each and every type of cell of endometrium and will lead to a good growth
But
of
sir,
endometrium.
it is like advisable to give the GCSF as a one-shot sub-Q and then after 24-hour PRP ideally to be
I
done.
don't
It
know
has
the
any
reason.
additional benefits?
The reason behind giving GCSF may be that it will mobilize the stem cells which are present in the bone marrow into peripheral, because that is how it is used for harvesting peripheral blood cells.
Peripheral blood.
That may have certain additional beneficial effect, but how much it would be is very difficult to say. But at the same time, PRP given locally in the endometrial cavity is going to be very, very good and very effective for the index.
The second doubt is that many people are saying that just instilling the PRP by the intrauterine catheter is not going to be work unless and until we do some scratching or introduce into the uterine wall.
Yes.
Personally, I believe that I prefer to instill by the intrauterine insemination. So that I had the doubt that just instilling by the IUI catheter, that is going to be work or not.
There are very specific reasons behind all this. When people say that it doesn't work when it is instilled in the endometrial cavity, very specific reason is all the platelets are intact when you are putting PRP inside. Now these intact platelets will release the growth factors over the period of half hour to 8 hours. Now anything you put in endometrial cavity is not going to remain there for more than half an hour. Everything is removed. So naturally it's not going to work if you put intact PRP.
Okay.
That's the reason we need to put PRP lysate. Now PRP lysate will have all the growth factors in solution which will be very quickly absorbed onto all endometrial cells within that half an hour's period. And it will definitely lead to good.
Going to be work. So by doing just by the
By doing the
intrauterine
lysate, it will work.
Okay. So nice explanation, because this is all in my mind. Doubt situation is that
Yes.
whether to do. So if we are do with the scratching or by the hysteroscopy, so that we cannot do in the index cycle. So there are two sides of the controversies
Yes.
are there. Okay, whether I should do in the index cycle. If I do in the index cycle, I have to instill by the IUI.
Correct.
And if it is by hysteroscopically, I have to
Then
introduce
you
that.
can put, that's a different story. But
That's
that you
a
cannot
different
use in
story.
index cycle.
So I personally not prefer one that, because sometimes what happens na during our IVF stimulation, suddenly we encounter thin endometrium.
Yes.
So and I don't want to waste that cycle. So this is wonderful solution you had given to
Yes.
us, that day 8 and day 11 just do a proper standardized PRP protocol installation will going to be one.
In fact, in my protocol, that's the reason why I suggest make 30x concentration of PRP, instill half ml lysate on 8th day, remaining half you instill on the 11th day. The difference here is you get very high dose of PRP growth factors and PRP growth factors which are insoluble form. Why people have failed in using thin endometrium and in the index cycle many a times, the reason is they have not used lysate.
Thank you.
Second one, which are the preferred day to do the PRP?
Sir had already told us
Yeah,
and
8
then
and 11.
8 and 11.
18.
8 and 11 day of this index cycle.
Index cycle.
And after 11 day, how many day we have to like not doing the transfer?
No, your transfer is as per your standard
Okay, so,
protocol after giving your
Okay.
HCG.
Thank you so much, sir.